So before we formally begin, I'd just like to acknowledge the traditional owners and custodians of the land that I'm presenting from, and that's the Bindal and Walgarukuba people, as well as those of the respective lands of everyone in today's call. I acknowledge the continuing connection to land, sea, and community, and pay my respects to elders past, present, and emerging. For anyone who's participating for the first time, so welcome to the Digital Champions Network online workshop. We'll hope here to deliver helpful tutorials, educational sessions, and present virtual services that will be accessible via the new telehealth cards everyone has. And we provide here a platform for peer discussion on all aspects of digital health as it applies to aged care. As it's a community, we encourage cameras on, mics on, and if participants pop their name, role, and aged care home into the chat box, everybody gets to know each other. So our speaker today is the lovely Michelle. Hopefully you've come prepared anyway. This is Michelle, a senior research fellow of the Northern Australian Regional Digital Health Collaborative, just used to calling it NARDIC. And I've had to look this up just to make sure I got it right, and I didn't. Michelle, I'll allow you to speak for yourself. I'm not doing a very good job, so please I'll hand over to you.
Thanks, Kieran. Yeah, they never make it easy, do they? So I'm a good morning, everyone, and thanks for inviting me. I am a research fellow at James Cook University, and I'm based on the Cairns campus, so a relative newbie to far north Queensland myself. I've been here for a couple of years, but a avid visitor for the last sort of decade or so. So I love being able to live and work up here. And so aside from my research role, which is primarily now focused in sort of clinical research, digital health and implementation, I also look after the Northern Australian Regional Digital Health Collaborative, or NARDIC. So I've sort of taken over that position as program manager. And I guess how Kieran and I have connected is over a project that NARDIC had initially supported, which involved the rollout of a couple of the Vision Flex carts, actually at the initial residential aged care facilities. And obviously we've all seen how that's grown and expanded into an amazing program. And so we've sort of connected over the past year of working in this role, but also North Queensland PHN is one of our partners of NARDIC, as is the CRC in Developing Northern Australia, CSIRO, Optus, and TARC, which is the tropical, I can never remember the exact acronym, but the health centre. So it's the collection of all the hospital and health services across Northern Queensland. And so I work with those organisations and anyone else who will, talk to me about digital health or who has digital health needs. So a lot of sort of startups and researchers and entrepreneurs. But my primary interest and focus is about how do we get really good products and services into healthcare and deliver that for people in rural and remote areas, to promote health equity and access. And how do we do that as easily and make that transition as smooth as possible? So that's where I like to be working in. What I'm here to talk to you about today very briefly is just to introduce you to a new course that NARDIC has developed over the years, but we've just revised and relaunched it. So I just wanted to share that with everyone. And it might be something that you're interested in doing yourselves, or it might be something that you'd like to share amongst your team or networks. And it is the only course in Australia that has been tailored specifically for rural and remote healthcare workers. In saying that, we have health professionals, people who are interested in working in that space. We have researchers, students, government folks. We've got a really wide breadth of participants since we launched a couple of weeks ago, actually, which is really great. So it's it's really for anyone who's interested in rural and remote digital health in Australia. Now, I'm going to share my screen if that's okay, because I think the easiest thing is just to show you our website so you can navigate through it when you're, if you're interested and have time. So this is our general NARDEC website, and you can find out a little bit more about the projects that we're doing and who we are and what we're sort of working on. But under the Education and Workforce tab, we have information about our micro-credential course. And really simply, it's a completely flexible course, 100% online, and it's completely free. And so it's a really simple process. So you can just click on the Enroll Now button. It'll send a form to me. I will set you up with a Learn JCU login, which is our platform at the university that has all of the course on there. You can come in and out over the course of, I usually set people up for a good 6 months, but we can extend that so you can learn in your own time. And you can also select which of the three credentials suits your learning the best. And so there's 3 credentialed courses. The first one, I'm sorry if it's really teeny tiny because I've got a really big screen, but the first one is about the foundations of digital health in rural and remote contexts. So just a really nice introduction to digital health within that context. The second is about leveraging or using digital health technologies in rural and remote health delivery. And then the third one is about how to implement digital health initiatives in rural and remote healthcare delivery context. And so they're really sort of, I guess, bite-sized online courses, and they take around, we sort of say, around 5 hours, although the people, because it's relatively new, the folks that have completed it, it can range anywhere from sort of 3 to 8 hours. It really depends on how much you go in and do the extra reading and that kind of thing. It's really up to you. To complete each of the courses, there's a simple, like a multi-choice quiz, or there's a discussion post that's a requirement. So it's not like there's a big test or an essay or anything like that, but it's really about applying learning. So I really just wanted to share that with you today. If it's something you're interested in, or to help us sort of spread the word, because it is, again, rural and remote focus, digital health, and free, which is huge, because some of these courses cost hundreds of dollars. Or upwards. And the other great thing is that I'm just in the process of getting some digital badging. So when people complete each of those little micro credentials, and again, you don't have to do them all, you can just do one, or you can do them in any order. You'll get a little digital badge that sort of says it's a verified course, that says you've completed it, so that you can use it as part of your, whether it's internal assessments or CV or that kind of thing, as well as a learning opportunity. So I'm going to leave it there. I'll pop the link into the chat, so just onto our website, but really simple. If anyone has questions, or if you'd like to promote it across or within your teams or organizations, I can always provide you with a little blurb. Really just trying to spread the word to anyone who's interested. Are there any questions? No? Fab. I'm going to stop sharing my screen. Bring everyone back to the main screen. There we go. Thank you.
I know I'm really keen to make sure this reaches all of our digital champions. I'll make sure this recording is passed through, goes out in the newsletter, every channel I've got, because I think it's going to be quite useful to the champions, especially with that aspect of implementation. That we've got that emphasis there on implementing new technologies. I think it's got a lot to offer in terms of guiding through these lone champions, sometimes actually encouraging adoption at their sites. So I think there's a lot going on there.
Yeah, great. We'd be really pleased if you could help promote it, because while it is available. And the feedback so far has been really positive, and really great feedback from quite a diverse group of folks. So yeah.
So Michelle, the modules are live now, the updated ones. Everything's all good to go. We
Everything's
can get in
live,
there
so
and get cracking now.
yeah, just pop in, enroll. I'll get your enrollment. I will set you up with a login, and you can, go in and do that in your own time. There's no restrictions or anything around it. There's help at the other end. We're always happy to take feedback, and it will be available till the end of September as a free course. After that, NARDEC is finishing up, because we're a government funded program, and we're hoping to then pass that on to probably James Cook University or someone within health services who will then continue the work. So hopefully that still continues. But thank you for the time and the space to talk about that today. I appreciate the interest.
No, I really like to see you dropping in, and as well, like whatever we can do, whatever engagement we can sort of offer. It's great to keep these things alive so that the legacy will pass on, hopefully, that continued funding, or those continued organisations that pass the torch to and continue to get that support, because learning and education, that freedom of information and access to it is such an important thing. So
well, such a changing space, particularly in digital health, and just okay,
lovely. No, so thank you so much for that presentation. Did anybody else have any questions there while we've still got? No, Michelle, you're welcome.
I've popped the link in the chat, and feel free to shoot me an email. You've got my details now if anyone's interested in anything else. But
no worries.
I might peel off and let you guys finish
by all means.
your meeting.
We'll wrap the recording and have just a little bit of group discussion just about the telehealth carts and just minors, technicals and that sort of thing. Thanks for dropping by, and we'll continue to work.
Thanks. Nice to
joint
meet you
work
all.
together.
Nice to meet you, Michelle. Thank you for that.
Thank you all. And I'll make sure those, Michelle's contacts, any relevant links, all that information is all published in our newsletter for later reference for anyone who is viewing this recording later. You'll be able to find it there, or you can get on to me directly. So I will just end our recording now.